Turn your head ever so slightly away from it. Yep. And I want you to smile real big and squint your eyes. Good. And relax.
Sharzad.
Yes, Susan?
What comes to mind when I say Botox?
I live in Beverly Hills. I got a lot of money and a lot of time.
Exactly. You worked at Neiman Marcus.
I did. I saw a lot of plastic surgery faces. Some look nice, some not so much. So I think I've seen like the worst of the worst. I've always been pretty terrified of making a mistake with my face because I do like my little old face, you know, and I don't want to mess it up.
You've never had Botox?
Nope.
But I have, and I get it regularly. I actually have it in my face right now.
And I do like your face.
And I
I'm
like
a
my
fan of
face
it.
too. We get carried away sometimes in the media and see these pictures of extreme women, and we see them in real life too, especially living in LA. I really think if you just go to the right doctor, you'll get great results. And if you're conservative with it.
I do want to be conservative because I'm a fan of my face as well, but I think that maybe a few little tweaks here and there would be fun. It's the only time I think I'll ever be conservative in my life.
Are you ready?
I'm ready.
A little nervous.
This is Susan Yara.
And this is Sharzad Kiadeh,
Some call this the Sharzad and Susan Show.
or the Susan and Sharzad Show,
We just call it
the SASS. We're gonna go see Dr. Dhir. He's in Beverly Hills, and he's a board-certified facial plastic surgeon,
Okay.
which really kind of is the best that you can get when you
Yeah.
want to mess with your face. You need to have someone that you can trust.
Right, absolutely.
Yeah. And he gave me my first Botox.
Oh,
I
that's
know.
so cute.
I know.
Botox virginity.
I know.
Welcome to the office.
Thank you.
All right, so today's gonna be kind of fun.
All right,
I want you
good.
to kind of just get those jitters out of the way. We're doing nothing right now.
Am I gonna be able to do that in a couple minutes?
Yes.
Okay.
You'll be fine.
All right.
You'll be fine.
See, this is my fear. Can I tell you my fear?
Absolutely.
I don't want to look like this.
Yeah, and that's
Yeah.
why I brought you to Dr. Dhir,
Yeah.
because you won't look like that.
I like to make a lot of faces and expressions, and I like to do impersonations, and I like to be silly. And I always want to be able to do that, but I have noticed some wrinkles and some things that I would like to have go away, like this.
The face is our most expressive feature. It's the way we show our inner confidence and demonstrate it to the world, people we love, family members, people we don't know on the street. There are different people who do Botox. It is a medical procedure, and a medical procedure can be done by many different people: nurses, injectors, dermatologists, surgeons, plastic surgeons, facial plastic surgeons, any physician. And anyone can do it very well. It is important that you go somewhere where you have a relationship with that injector.
Right.
The reason is that they need to know your goals, the things you do in life, what they ultimately want. Everything in aging is volume loss and gravity.
Okay.
So just starting on the forehead area here, the skin starts to get thinner. So you start to see wrinkles. You brought up the 11 lines. And as you smile, the skin around the eyes starts to thin. You start to see the fine lines called crow's feet. A lot of women always come for this one. My favorite is crow's feet because when we smile or we're on camera or meeting people, these are the ones that show. So small injections around the eyes, they're called neuromodulators, which are just a fancy term for Botox, Xeomin, and Dysport.
Okay.
We're going to be using Botox today, so I'll continue using this Botox. So Botox around the eyes can soften that, so when you smile, you don't have those fine crow's feet.
Okay.
So for you at 31, you have a lot of good volume. You have great cheekbones that are holding on the volume. So I think your concerns are just being youthful, looking refreshed. You have
Yes.
a baby, look
Refreshed.
relaxed.
Yes,
Rested.
like I slept. Yes.
I actually think that's the best way to look like you are refreshed, is a little bit of Botox, and I think that that's the best thing that any new mom can do,
Okay.
is to kind of
Once you
Let
stop
it go.
nursing, yes. So what are some potentially negative side effects?
So potential side effects can be kind of distributed between the short ones that can happen right away and the ones that when Botox does take effect, which is 7, 10, or 14 days. The short ones are possibly getting a bruise. Very rare, but you are putting a needle into the face, and so a bruise can happen. But in general, Botox bruising, smallest needle, is a 30 gauge needle, probably not going to bruise. But that's one thing that can happen. A bruise, every patient's different. Lasts 3 days, 5 days, 7 days, but it goes away. But makeup can be used right away.
Okay.
So those are kind of the short-term, quick potential. Pain is the second one patients always ask. It's possible to have some pain. We do a topical anesthetic and let you sit for approximately 3 to 5 minutes to take the edge off. And also icing before and after can help with the pain. And the third one we're going to talk about is complication that can happen for the long term. Well, Botox is micro-paralyzing the muscle. So the result, cosmetically, is going to be great. However, if it's injected in the wrong place, if it travels somewhere it's not supposed to, can give an asymmetry. Those things are very rare, but if they do occur, the good news is that it is temporary.
Right.
It will go away.
That's one of the best reasons to see a board-certified facial plastic surgeon like Dr. Dhir or a cosmetic dermatologist, because they really know what they're doing. They're not going to do something like that to your face.
Right, cool. No frozen face.
No frozen
Not up in
face.
here.
No.
All right, well, I'm excited. Let's do it. Shoot 'em up, cowboy. Yeah.
I think she's excited.
I just, maybe.
I'm
maybe.
glad to see
yeah.
that. Let's make you look refreshed.
Yes.
You want me to hold your hand?
Sure. Your hands are so little and
I
soft.
know.
Turn your head ever so slightly away from it. Yep. I want you to smile real big and squint your eyes. Good. And
Yes.
relax. Okay, great job. And here's the poke, and that's it.
That's it?
That is officially your first Botox procedure.
How do you feel?
I feel great. Yeah, that was easy, you know, tiny little pricks, but I wouldn't necessarily classify that as pain. I feel like if anybody's ever had acupuncture on their face, it's kind of equivalent to that, maybe a smidge more intense. This is Los Angeles, okay?
So she's
People.
not going to see really anything start to happen until like earliest, like 3 days, right?
Right. So these bumps that she sees right away, these will go away in about 10-15 minutes.
And if I had any like terrible reaction to this, I would know like right away.
You would know
right?
right away.
Okay.
Yep. An allergy is very rare, if not, never been reported.
Right.
Now that you're done, I'm going to put a cooling ice pack on
Okay.
here for your comfort. You can take your right hand. Boom. You did it. Congratulations.
Thank
on your
you.
first Botox procedure.
Woo-woo.
So what to expect now is you're going to get a call from us in 24 hours to check up on how you're doing.
Okay.
And I'm going to see you in 2 weeks at your follow-up appointment to see that we got the result that we wanted.
Cool. Thank you so much. I'm so excited.
Thank you, Dr.
Thank you.
Dhir.
Thank you. Thank you.
High five. You want a high five?
I do.
All right.
Yes. Look, you guys, I can still make faces. Just a Botox face a week later. I'm feeling good about everything. Still getting used to my new face. I do feel refreshed, and I really like that this little line is gone. I can still move. I can still make a lot of faces, so I'm excited about that. And I'm just, I'm curious to see how the next 3 months go. But I feel good. I feel like I'm still pretty cute. What do you guys think? Leave it in the comments below. Would you try Botox? Remember to subscribe.
To see the sass.
The SASS.
The sass.
My brows move up, but they don't move in. Bye-bye.